Welcome to the Health Quarters Ghana, where medical science meets everyday life. Join Dr. Gideon Hassan and the irrepressible Clemento Suarez as they tackle health issues.
My name is Dr. Gideon Hassan. I have with me here my co-host, Clemento Suarez.
I knew how it felt anytime I started to feel the pain.
Whether it is hernia, breast cancer, cataracts, or infertility, the show brings together victims to share their real-life stories and experts to debunk myths.
If you wear cotton supporter, and they be a pampers and a benwa or bosom. So you see, instead of it being raw egg, I done it because you want milk.
Make a date with us every Sunday at 4 p.m. on ChannelOne TV. Don't forget to subscribe on YouTube and all social media platforms at Health Quarters Ghana.
Alrighty, thank you so much for staying. Well, you just caught that snippet, right? It's coming here on Channel One Television. I think it's from the 28th of December.
Yep.
Yeah.
Every Sunday 4 p.m. You say if you wear the supporter, pampe na achichiro. Only one person can say that and get away with it.
Who else?
On national television.
Only one person will. Listen, don't go and try it. He has a license to say whatever he wants. Don't go and try it, especially in this era.
By June, dear. By June, dear, 4 years ago. He said, by June, dear. You know.
That person is here. That person is in the studios. That's Clemento Suarez.
Thank you,
He is an actor. He's here. But he's not here alone. He's here with Dr. Gideon Hassan. He's the project lead for the Health Quarters Ghana, and he's a family physician specialist. Gentlemen, welcome.
Thank you.
Doc, I'll start with you. How do you deal with this man?
I bet you on the same question.
Yeah. How do you deal with this man?
In terms of
everything. How are you able to finish a shoot with this man? Are you even able to deal with internet?
it's difficult. Cuts.
Because
because this is a battle. White versus dark. And you are going to the okay.
Oh, but it's difficult. But
No, he has seen the light, so he wants to go in the light. But it must be fun. It must be interesting.
Yeah.
I mean, bringing all your knowledge and expertise to his knowledge and creativity.
Yeah.
It must be quite an interesting experience.
Yeah.
So tell us about it. Health Quarters. What is it?
Oh, Health Quarters is more like selling the health message to the Ghanaian people and to the world at large. You know, we as a team noticed that the idea of health, it gets boring when it's just one person talking, when it's just one person giving the interview. So we're thinking through and we're like, what can make people have fun whilst being educated in terms of our health?
Right.
So we decided to merge the hilarious aspect and then also, you know, still sell the message as supposed to be sold.
Yeah.
So basically that's it. We are going to educate the people. As a medical doctor, I'll bring the facts about health, try to clear some misconceptions. Of course, we will be having other medical doctors and experts on the opinion. We'll have Clement, who, to be honest, also knows a lot about health.
Yes. Is it health? Is it good? Health, yeah. Please continue. You continue.
Carry on, sir.
Just that he deals a little more with the streets. You know, he goes to the streets, gathers the myth, and then comes to challenge the experts on it to see if we also agree with them.
You know why I'm laughing? When he said he knows about health and he deals with the streets, but why going straight to Magani? I want to.
Adua.
He started this year.
I'm gonna check myself.
So in a nutshell, that's what it is. It is about talking about our health and then having fun at the same time. And we try to clear some misconceptions.
Right. Clemento, what is it like for you? What's it been like for you?
Well, for me, it's a great experience. I mean, it moves me away from strict comedy to education, because comedy is supposed to educate, but sometimes you laugh and you forget about the real message in there. But this one is quite structured, so we are actually laughing, but we are learning the real stuff. So I think it's a different experience for me, and I love it.
Amazing.
You know, you're spot on, Dr. Hassan, because more often than
How about me?
that's not one
You're a
kind.
sport.
The punctuation mark. I host a show on Saturday. I was telling you off record. Every Saturday and Sunday on ChannelOne TV. We have a full-blown health segment, right? But it can get very boring.
Yeah.
I'm not even joking. I realized that only people who are possibly facing the conditions are the ones
Interested
texting
in
me.
it.
You know, other than that, my mom would tell me that, they do health segments, because it gets very technical. You know, they are talking about sometimes they don't. It's technical. The names are. So for me, I love that you're able to break down the same issues in a way that's easily, consumable, right? So great stuff. I want to find out what will be some of the issues you'll be talking about.
Apampempa.
I didn't ask the question.
Apampempa.
Are they 224?
Oh, we don't mention names.
Me, I'm very cool. Way to do that.
It's an issue where only people who are suffering that
How
will be
critical is
interested in
Apapempa?
it.
In the scheme of things, how critical is Apapempa?
What's the medical term for Apapempa?
Hair apnea. It's very critical. It's not an issue we'll treat.
Yeah, we'll talk about
I'm trying to comport
Why?
myself.
Why?
Because you see, when they said health quarters, ordinarily you would think of headquarters. But then I saw you on the show,
Yes.
and I understood why they changed headquarters to health
Oh,
quarters.
it's not. I mean,
I
in the health
intentionally throw
quarters.
it in there.
In the health quarters.
But when we talking about baldness, right?
Yeah.
So
We'll be talking about everyday
Everything,
issues.
including baldness.
Yes.
Yes.
Yeah.
We will try not to be too technical.
Then the bald people, you should be paying attention. Not those of us who do sakura as a hairstyle.
Yeah. We know.
Yeah. Let me explain.
Oh, guys.
Okay, cool.
Wow. So
You deal with them. Baldness, man. I don't know what I do.
and every other day.
Yeah,
health
everyday
conditions.
health conditions that are quite popular and are surrounded by a lot of misconceptions. I mean, we all know them. We know the hernias, we know the cataracts, we know hypertension, we know ulcer, we know diabetes.
The other challenge with healthcare delivery in the country is that a lot of the research to support treatment is rather foreign, right? It's until recently that we had like the physicians and colleges of surgeons, actively coming on board, right? But for example, you want to Google a symptom, right? You see white men.
Yeah.
I'm sure you are aware of this. You want to Google some treatment, you see the idea behind it for like foreigners, So I get the sense that this is tailor-made for our system. It's tailor-made for us, our terrain, the kind of people we are. I want to believe so.
For real, because when you talk about medicine, it has geographical consequences.
Okay.
I mean, the kind of conditions that the typical African may suffer may not necessarily be what the whites or the Caribbean may suffer. I mean, if you come to our terrain, we may have malaria.
Yeah.
But if you go to the European countries, you hardly will find it. If somebody has malaria in the Western world, it's an emergency. But here we have developed some form of tolerance.
It's a 3D.
So if you go there, there are conditions like maybe cystic fibrosis.
Yeah.
It's something that's more common with them, but not necessarily with us. So there are things that we'll be dealing with. We'll start from home. Of course, we'll be starting from home. What are the health conditions that we are going to talk about? What are the things that in our homes people talk about? Those are the ones we'll be focusing on. And then what the myth is about, what the people are saying. And then we'll try and clarify them for the general public.
You should add the stereotypes, because sometimes some people feel like once you get a certain disease, an outcast.
Yeah.
So maybe you should try to demystify the stereotypes for us as well.
Sure.
Yeah,
But
I
trust
think
you.
I think we input all those kind of things in there. So For instance, some people think that if you are short and you don't have hair, you are likely to be a president or something. No. It's not like that.
If you are short, I don't have what. You don't know. I don't want to be the one to repeat it. I was saying,
They should watch the omnibus of this program.
so if you are short and you don't have you can be president.
It's a myth. You are past
And that one is as a result of DNA or what?
I don't know.
It is a
Wow. So all of that and more will be on the show.
Of course. Yeah.
But how wide are we casting the net in terms of the specialists that will be on the show? And of course, you've mentioned the types of diseases that you'll be touching on. But how wide are we casting the net? And who should be interested in watching this in the first place?
Fortunately, I'm in the health space.
Right.
And I deal with all sorts of specialists. And so whatever condition we decide to talk about, there will be an expert about it.
Right.
Either the person has lived it. We have shows where, or episodes where we are bringing people who have lived the condition. People who have been kind enough to tell us the kind of condition they've suffered from. Maybe IE, maybe KSEP is on our show talking about prostate cancer because he has lived it. We have someone who has LC, suffered breast cancer. He's a survivor. To come and tell us about the stories. You know, so we'll talk about people who have lived the condition, and then we'll bring in experts who will come and also educate us.
Is he on the breast cancer episode as well?
Yeah.
He's a so
In the coast.
You like
I'm a
breast?
man.
You like breast?
The breast is of nature God.
Yo.
Director, please. I don't know.
So it's a co-host.
Yeah.
Yes, I'm
So,
on it.
Yeah, so he'll tell us what he does on the show.
But don't get carried away. That does not make you a doctor.
I'm a doctor. Ask him. Ask him.
If I call G-Tech for
Hey,
if I call G-Tech for
I'm a doctor.
Have you heard of GTech? Ghana
Yes.
Tertiary Education Council.
Go and check. I was part of Mohammed's team like last year.
You see where it's going. You see where it's going.
So, Dr. Asa,
Yeah.
what's been, or maybe Clemento, you should take this. What's been the feedback like? Because listening to Doc, he says you go on the streets, you talk to people,
Yeah.
you try to gather views. What have they been saying to you with regards to some of these health issues you want to talk about?
Some of them receive the seemingly new stuff that we bring to them, but others would rather stay with the old stuff that they have. Like they think some things are traditional, you can't change it. Something like ulcer, people think that it's as a result of long hunger or something. But when you tell them that hunger doesn't cause ulcer, they don't want to believe it. So some people are actually receiving the good news from doctor and from these doctors. But there are others that we have to really work hard. The things should be drummed in day in, day out so they can get it.
Do you get a sense that the level of education also plays a role, right? So, for example, the literacy rate, right? So, for example, if somebody is more educated, their chances of accepting superior knowledge is higher as against a tractor driver who was an apprentice and became a driver. So how are you going to incorporate all of those in your message you'll be sending out?
You are spot on. Literacy has everything to do with this because there are some people who are in Ghana here who actually believe that those selling in trotro and those medicines or drugs can cure all the diseases. There are some people
one drug.
People actually believe that. And so
they buy.
And so it will take literacy. But what we are doing to curb or to make everybody inclusive is that he's doing the direct literature stuff, the rights,
the research,
formal stuff. Then I may come in, dilute it small so it gets to the last person. So we are trying our best.
Very well. And I think it's good. For me, I think the communication aspect is really good because just like Jude mentioned, if you are listening to a doctor who is a trained doctor, not trained to communicate, and they are telling you that, okay, this is as a result of this, these are the symptoms you are going to have when you get it, this is... like I even tell you that you have 2 years to live.
Sometimes the way they write is the way they talk.
Exactly.
Is it the doctors? That's how some of them talk.
Yeah.
That's how some of them look. They look like
they look like they're writing.
Yeah, some of them, I don't know.
That's how I sit in next to you.
You don't talk like that.
So I think it's good that you're bringing Clemento in to, if you like, lighten the conversation, lighten the communication.
This guy is laughing too much. Diagnosis.
I think he needs to be diagnosed.
Somebody looks like
the way they write. Diagnose him for me.
how can you come to the show with your colleague?
We have diagnosed him.
So what's his condition?
Hyper bipolar.
Charlie, this one is misinformation. It's misinformation.
How you guys sit on Christmas Day, Boxing Day, and then people look like the way they write? I mean, who does that?
But I have a nice handwriting.
Nobody can mention him on this name.
You look like a handwriting. Take it. If it's nice, it's nice. You are nice. Don't worry.
Wow, that's why you're triggered.
You're mounting a defense when none is needed. But anyways, Health Quarters Ghana.
Right.
So we'll start airing on the 28th.
Yeah.
But why did you bring it to us?
I think that's a good question. And we had a.
It's not a good question. Yeah, why did you bring it to us?
There are a lot of channels.
Oh, my friend.
It's a good question. Because Channel we did give us the funds.
I mean,
yeah.
we have a wide range of audience.
Yeah. Level-headed
And
audience.
it cuts across. I mean,
Exactly.
from the streets
Exactly.
to the middle to the first class.
Exactly.
So we felt like if we have any opportunity to be on any radio station, it has to be ChannelOne TV.
TV.
Yeah.
Wow.
Clemento, why ChannelOne TV?
Yeah, I think they're connected with the message we have, and they want it to be fun. So the question should rather be, ChannelOne TV, why us? Because they found it very interesting. Like I said, connected to what they are doing as well, or what you are doing. Let me just say that. And so they thought that if it's on ChannelOne TV, it's just something great for the Christmas and then the years beyond.
Well, what has been your favorite topic so far?
Obesity.
Obesity.
Yeah.
Hey.
I'm on for things. Obolo ye nam. I'm enjoying meat. But one say, what the form team. Yeah. And we had one on cataract and glaucoma.
Okay.
Which I think is also a very serious thing that we should all pay attention to.
That one you should have invited your brother,
Which one?
the eye doctor.
Yeah.
We'll be on the show at the point.
Yeah.
Which episode did you say people have been wearing boxers pumping?
That's infertility. Yeah.
Infertility.
But it's true, yes. If you do that,
I think
you are cooking your children.
It's an interesting episode.
You are cooking your children. It's true. They think that.
You know that during sex, should I do some medication?
Yes, of course. That's why. Now why do we bring you here?
It's part of it.
Yes, this is the first episode.
This is the live episode.
Actual preview.
Yes.
If I say all of them now,
What will you say? Doctor for the
Of course. I want to enjoy my Christmas.
Yeah, so infertility during sex.
I think he mentioned that.
Yeah.
During sex,
what
continue.
happens?
During sex, what comes out during ejaculation is not necessarily just sperms. It's semen. Semen is sperms plus other maybe seminal fluids, other things. And then this sperm has to be a certain quantity in order to be able to be fertile. God in his own wisdom made sure that the temperature in the body doesn't affect sperm production. You know, the temperature of the body itself is quite higher and unfavorable for sperm production. So he gave men balls that hangs outside the body.
Okay.
So you realize that if
In tree, it's called bolo bolo.
if your temperature is high, your testicles descend.
Okay.
If it is cold, it gets it shrinks, get closer to the body. In order to get an optimum temperature for sperm production. You understand? So if the environment is warm and then the testicles are hanging,
No,
and then you decide to still wear tight boxers to get it closer to the body. What do you think you'll be doing? You'll be cooking.
Exactly, yeah.
So you so if you wear those tight boxers and then you get your testicles close to the
topics they could
Charlie.
just you brought it out. All the health topics. Like it's
Charlie.
eating anything anyhow. I
So
felt like
okay, change it.
No, it's fine. It's fine.
But fertility is about Christmas. Jesus was
Born. It's the reason for the season.
Yes. Just that they didn't have sex for him.
Yeah.
But yes.
He wasn't born through sex. Is it the born?
So you bring another.
No, it's fine. It's fine.
No,
The point is well received.
the people are asking for a health tip from you, so give us a health tip.
Yeah.
Which people? Geographical inclined. So
Your own geographical location,
yes.
you own what?
Yes, he told you that.
All the
Help
people
tip.
watching us.
All the people. But if taking one from, we do one tip a day.
and it's taking the
Yes.
But health quarters, to be honest, I think it has come to stay, as far as I'm concerned. The genesis of this whole health quarters started whilst I was in medical school. You know, whilst in medical school, I used to watch these health, and I felt like no, we need to be a little bit more dynamic. Doctors, most of us, we tend to be consulting bound. We are in our space. We don't like trouble. Understand? But I feel like
who likes trouble?
so now you carry up and alcohol.
Now, me and I put out.
Meaning touch
Who should be able to say next week? Then who will?
What kind of tea so?
Yeah, we shall let you.
No, keep going.
So
Charlie, this is a show to look out for.
So after medical school, right after medical school,
Yeah.
I hatched the idea of bringing comedy into health, but then still driving home the message. And then I was in Cape Coast Medical, UCC Medical School then. I did my house job, what we call national service, in Cape Coast Teaching Hospital. So after that, I moved to Accra, Achimota Hospital for my second year. Then I still wanted somebody to help me bring this idea into fruition.
You don't always have Clemento
He
in
was.
mind.
There's no way you can have Clemento in your mind if you are going to talk about something hilarious.
Yeah.
It's not possible.
Yeah,
he
he's
wasn't
the
my
guy.
friend then,
He's
but
truly
he
the
was-
guy.
Possible.
It's not possible.
It's possible.
Are you happy with yourself?
Yes. Because there are a lot of comedians in Ghana, like better than Clemento Suarez. So you can't say that. There's no doctor's name Shroddy.
Opinion. My opinion is
It's subject, exactly
Yeah.
subject to the
so what do you to be a better
And like I
chance?
say, in my opinion.
So there's no way you can talk
Oh,
about
cancer. Yes.
There's no way you can talk about
There is a way.
hilarious
There is a way.
without having Clemento in mind. So he has always been in mind. So I contacted my very good friend. He has been extremely supportive. He's called Benjamin Alpha. He's now a lawyer. An extremely brilliant gentleman. So we came to the table and then we decided to brainstorm. So we tried to reach out to management of Clemento Suarez. And it was an easy decision for him because he felt like this is a brilliant idea. As at that time, I was a very young doctor. Yeah, it was interesting to know that he pays some of the things for me in order to get.
But Mejai.
But he said you paid, so
Yeah, in order to get some of the things done because we didn't start with podcast.
Okay.
We started with short skits.
Okay.
You understand? And so, in order to get 5 minutes of Clemento's time, it's a Herculean task.
I imagine.
Yes,
Busy man.
very busy man. Everybody's pulling
Busy
him.
man.
So sometimes he needs to come and shoot for us, and then go into big productions, go and shoot with Ajay Tangnan and other people.
Yeah.
But then we are
Oh,
who am I?
Sikai.
You understand? In terms
I know,
of
I
this
saw you.
creative space.
Yeah.
But he comes, he will even charge you once. He uses his own money, his own car fuel, and then go. So
Incredible.
Alpha and I were like, this is our guy. This is somebody who can help us. And then, of course, I've had some other medical doctors who have been supportive. My very good friend, Dr. Alfred K2.
Okay.
All those people have been very supportive. Lauricia Pekon, Nanaya Pia.
The Ministry of Health
Yeah.
and Kolebu.
Kolebu, Minka Ministry of Health.
It's me card they
He's not
supported.
saying, he's also giving his vote of thanks. So
Yes.
it's from them.
So yeah, so that's how everything started. Then right after we moved to this podcast, during the skit, now me break a cry. you see, because Mr. program, no,
Oh, you're natural.
only Ojo, the two of them.
Ojo day is like.
Yeah, Ojo, Ojo is part of us actually.
Yeah.
Most of the episodes he's
I
with
hope
us.
you don't have him explaining the history of any condition.
I know. Wow.
Because the story he will tell us.
But truly, it's an inspiring story to think that, you know, somebody in medical school, because like the average doctor wants to just go to school and get done and earn a salary, right? But to think that even in medical school, as young as you were thinking about public advocacy, you know, public health, trying to get the message out there. I think that is really inspiring, and I'd want to say congratulations to you.
Oh, thank you.
Well, to the
It's
team,
not been
you know, to the team,
soft,
you know. If we had, usually say, my boss Bernard usually say that, like, it's usually about brightening your corner where you are. Like, imagine everybody starting small and doing something in their own capacity to, you know, because you could have just thought about yourself and your family. If it was only about what you and your family eat, I'm sure you'd be fine. But looking out for the market women out there, the tractor driver who is sitting on his engine seats and is cooking the sperms according to
Dr. Suarez.
You know, looking out for them, for me, is a big deal. And I say congratulations.
I think in the course of the show, we have some known faces who be passing through. We have Samini come to share his story. We have Jocelyn Duma on board, KSM, Ojo himself.
Jocelyn Duma.
Oh, quite an A-list.
Yeah, so all those ones are.
Like
What did Jocelyn Duma come to talk about?
This guy.
Was I there? He's asking what she came to talk.
Jocelyn Duma.
I worked with her. Advisor. So,
But you like her.
I like everybody.
You want to marry her.
I'm already married.
Before it delves into some rounds we can't control. Anyway, guys, so Health Quarter is airing on Channel One TV.
Yeah.
Great news. 4 p.m. every Sunday. So you're back from church. Your Sunday relaxation just got better.
Yeah.
It's not only about the fun, it's also to educate and inform. Insightful conversations, relevant conversations, very important conversations on health. You don't want to miss out. Thank you so much, Dr. Gideon Hassan. Thank you so much, Clemento Sarah. It's always a pleasure having you, you know. So guys, you don't want to miss out. We'll be on our YouTube, I want to believe as well.
Yeah.
Or on Health Quarter, Health
Quarter's
Ghana
Ghana, okay.
YouTube. Go there, watch it, share the link, you know, share it. It's very important.
Let's spread the message.
Exactly.
The gospel according to Clemento.
Spot on. So someone
Do you want to be a pastor true? Say he has conferred on you, apostle doctor.
Mess call.
And
And the number is private. I can't call back.
God, you have heard him. You have said on national TV that he doesn't like you. Do whatever you want.
Oh, guys.
God knows best.
Guys, those who started watching from the beginning, the funny thing is we're talking about Clemento even before he came. I have no idea when he'll come here. You know, then he shows up. It's funny all of these things work.
Yeah.
It means that Health Quarter has come to stay.
Indeed. I will look forward to it. So you should join us on Sunday, the 28th of December, 4 p.m. and every other Sunday. All right? It will be live on Channel One Television. And like Jude mentioned, go on YouTube, look for our Health Quarters Ghana, or you can stay with us, Channel One Television on YouTube. And of course, you get to learn and have fun and spread the word. Okay. Doc, thank you so much.
Thank you very much.
Ojo,
Merry Christmas to everybody.
Merry Christmas. If I don't say Merry Christmas to Francisca.
Then say it to her.
Please say it.
Merry Christmas to my little sister Francisca.
And as we are done with the program, we'll be waiting for your gift. I hear that Channel One TV is the best. They are unboxing. They give out gifts.
True. So we do help a Christmas child. So we take
this,
then we give it out.
Oh, we have gifts. We have gifts for Clement. You know the almond tree on the compound.
I like.
Is it Clemento's head alone is how many years? He can't be a child.
Please, if you don't give me the gift, I'm going to another TV station. Whatever I will say there is between me and my mom.
You know what you can say. You know what? We'll take care of you.
Guys,